Hi, good day everyone, and welcome to another episode of the Afya Health and Wellness interview series from the center of the Agbari Multimedia Company. If you're new here, welcome to the channel and thank you for stopping by. And if you're a returning subscriber, it's great to have you here again. And don't forget to like, subscribe, and share this video with your loved ones because you don't know whose life the information here might be saving. At Afya, will be inviting well-seasoned health specialists to discuss some disease conditions, educate you on the causes and treatments, debunk some of the myths you must have heard about those conditions, and provide you with actionable tips to prevent them and healthy living. On today's episode of the show, we'll be talking about diabetes, so you have a good understanding of what it is, and providing you with actionable tips to prevent it or manage it if you have it. We have Dr. Olusegun Ogunwale here, an endocrinologist and a diabetologist with over 20 years of experience to give us all the information we'll be needing for this talk. So without further ado, let me introduce Dr. Olusegun. Dr. Olusegun Ogunwale is a healthcare practitioner specializing as a physician, endocrinologist, and diabetologist. He received his MBBS degree in the Lagos University Senior Hospital in 2000, after which he proceeded to specialize in the endocrinology field. Currently, Dr. Olusegun consults in private practice and lives in Lagos, Nigeria.
Good morning.
Hi, good morning. Good morning, Dr. Olusegun.
Yeah,
It's
good
great to
morning.
have you here. How are you doing, sir?
I'm very fine. And you?
Fine, thank you, sir. Thanks for asking. Okay, so we just read through your bio, and I feel like the audience is excited to meet you, as I am. But before we get into business, I want to ask just one question. So you went into medicine 2000. So why did you go into the endocrinology field, and why become a diabetologist? Why did you specialize in that area?
Well, right from my undergraduate days, I like the way endocrinology is about study of substances in the body called hormones. These
Okay.
hormones regulate, many functions in the body, produced from one side to act on other aspects of the body, and I was really fascinated even from the days where we were doing basic medical sciences, especially physiology, on how these hormones work. Some of them insulin and some other hormones. Insulin regulates how sugar and other food substances are regulated in the body. And so it was fascinating to me. And apart from that, later in life, I found out that even diabetes, which is one aspect of endocrinology, is something
Mhm.
that is also near me. I have relatives, uncles, aunts who also have suffered, and it's a mixed feeling. Some of them have actually sadly passed on, and so when I see my patient, I tell them practicing endocrinology and is not just source of income, is a passion, is a calling, because I've had experience and I'm determined to also help people, you know, going through
Yeah.
such kind of, you know, illness and diseases too.
Oh, okay. Thank you for that answer, sir. Thank you for that answer. It gives us a lot of insight. So we know that you're not just doing this for the money, you're doing this because you actually care about it. And so we
Yes,
can be sure that whatever advice you are giving is from years of experience.
yes.
And so my first question would be, so we're talking about diabetes. Could you give us a background, with a background knowledge or background introduction into what diabetes is?
Okay, diabetes, I'll try and be as basic as much as possible. Is a disease that has to do with, you know, problems that arise when I remember I mentioned one particular substance called insulin, which is a hormone produced in the body to regulate, you know, the things like the way our carbohydrate that we eat, protein, fat is controlled in the body, how it is handled, how they are, broken down and to release energy. And so diabetes begin to come into play. It's a disease that comes into play when we have problems with production of insulin or with action of that insulin, or even with the combination of both production of action, which will now lead to things typically where we have increase in blood sugar, glucose in the body over a long period of time, and causing some problems, which we will discuss later, because of that increase in blood glucose, and also the range problems that also have to do with other parts like protein and fat, because insulin is not well produced, or is not even produced at all in some, or even when it is produced, it's not acting very well. So diabetes, in short, deals with problem with action and production of insulin, leading to high blood glucose in the blood, and also problem in handling fat and protein in the body. So that's in a nutshell what diabetes
Okay.
is about.
Okay, sir. Thank you, sir. So, following what you said, what are they? What are the types of diabetes?
Okay, there are
Because
two broad types. There are different types, but the two main types we hear of: type 1 diabetes, which is relatively not common and is much more common among young children. Yes, children usually less than 18 years, and even some of them very early. And they particularly have a problem with producing insulin. Their body is not producing any insulin at all, so their sugar becomes very high, and they need insulin to survive. We have the more common one, which is the type 2, which tend to represent about 90% of diabetes. And that one is commoner in the middle age and the young people, and even in the elderly. And the main problem, they still have some insulin, but the insulin is not really acting very well. We have some things that we call resistance to insulin and some other issues that borders to affect insulin. And on the long run, the sugar also goes up, and most ones may need some medications and some other things to regulate. Also, we have diabetes that occur in pregnancy. Yes, probably for the first time, most time it occur in pregnancy. That's another. And then we have some minor types that not so common, but they are just there. But the major ones are the ones that I've mentioned.
okay, so we have type one
Type
insulin
1, type,
dependent, two,
yeah, yeah, type
and then
2,
now
and
diabetes.
then the pregnancy associated or pregnancy induced diabetes, and then
Okay.
some other ones that some are drugs, some due to some other things that,
Okay.
yes.
Um, okay. Thank you for that, sir. Okay, so that brings me to the question: what are the signs and symptoms, like in the
Good.
presentation of
Now,
this?
now, most of the common symptoms that people will present with. Now, what glucose does when it is high in the body, it draws water with it. The water passes through the kidney, and people find themselves urinating large volume of urine. They are urinating a lot of urine, and of course, when you are urinating a lot of urine, there's deficit. You become thirsty, and so the person, what most people will complain about is that, I find myself urinating very frequently and plenty of urine per time, you know, and I'm drinking water. I'm always thirsty, drinking water. And then some then start to lose weight. Now, why is this happening? Is because there's so much sugar, there's so much, but the body can't use it. So the body start looking for other means, breaking down itself. So three main things that happen. Person is urinating frequently, and so he has to drink water frequently, and over
Mhm.
time he start to lose weight. And there's some people, maybe the younger ones, they even tell themselves getting hungry too frequently, because the food the glucose, those things that they have, they can't use it.
Okay.
So three main things: frequent urination and
Okay.
with large volume of urine, frequent increased test, drinking plenty of water, then losing weight. And then in some
Okay.
people, even increase appetite. They are eating, but then there's nothing to show for it because the body can't use the food. Okay, sir.
Okay. Thank you for that, sir. And there's this one of some people. There's this conception about tasting your urine and if it's sugary. If I make
Yes.
correct.
You know what they, like I explained, what is happening that the fast urine is going through the kidney. The kidney,
Okay.
I know the glucose drag water along.
Mm-hmm.
And the urine they are passing, if for any reason maybe it drops on the floor, the next thing you see that the ants are gathering around it.
Oh,
Ants
okay.
like sugar. So anywhere there's sugar, they will come. And if at all, some people have actually tasted and say, ah, let me, what is going on here? And it's, yes, it is sweet. Okay, let me even tell you, diabetes got its name. Diabetes is like a word which means plenty of urine.
Mm-hmm.
Yes. Now, diabetes mellitus, which is
Okay.
mellitus means sweet. So plenty of urine that is sweet. Diabetes mellitus. So if we can get that, I think it will us to understand what we are dealing with. Plenty
Mm-hmm.
of urine that is sweet.
Great. Oh, okay. Okay. Thank you for that, sir.
It's
That,
a
I think that's
Latin
quite
word anyway, it's Latin. So from there it captures what is going on.
okay.
Yeah.
Okay. Thanks, sir. Moving on. At what point does someone have to see a doctor? At what point? What do you see with me? At
Yes,
what point
as
does
soon as
someone?
somebody is experiencing these symptoms,
Okay.
yes, people will want to first explain, maybe because the weather is cold, or maybe because I'm drinking too much water. Because if nothing is done over time, the person will start complaining of other things. Maybe I'm feeling dizzy, my eyes is blurry, I'm becoming weak. Yes, because there's so much, yeah, the body can't use it. So there's no energy, the person is getting weaker, becoming dehydrated. You tell the person, open your mouth, the mouth is dry. We don't need to even get to that stage. If a person is urinating, probably most of us do not go to the toilet more than maybe 2 or 3 times, and we don't even wake up at night to urinate, or maybe some people wake up once. But if you find yourself, you are urinating too frequently and you are becoming too thirsty, you are drinking water all the time, you are losing weight, you need to go to the hospital to go and do a check. It might be diabetes that the
Okay.
person is dealing with.
Okay. Thank you for that, sir. Well, I'm following up on that. I want to ask, what about in type 1 diabetes? You know, type 1 diabetes is sort of from childbirth.
Well, not necessarily
Yes.
childbirth, but at least children.
Yes,
The
children.
youngest I've seen, I think, was a 3 month old. Yes, so it's close to
Yes.
childbirth in some people, and they too present even more drastically with that, because in type 1 they don't have any insulin, so their own is more dramatic. They are urinating frequently, the child is losing weight, is drinking
Mhm.
water, and some of them, if they didn't find out enough, they might pass out, become unconscious, and then that's where some of them are rushed to the hospital for the first time. So it's the same presentation, and there may
Okay.
be even more drastic, more aggressive, because there's no insulin. So they present with the same thing: urinating frequently, becoming thirsty, uh, the child is losing weight. And if nothing is detected on time, the child passes out and they start rushing to the hospital, and they go and check them and find out that the sugar is very high in the blood. So it's still the same kind of presentation, albeit is usually more drastic in type 1.
In type 2. Yes. Okay. Thank you for that. So moving on. So when we work to see any of these symptoms or most of these symptoms, passing out large amounts of urine, sweet urine, increased appetite until you're feeling hungry, you should head over to see a doctor.
Yes, increased appetite is even more common with this type 1 people. Yes,
Okay. That's
because
good
it's
to know.
not normal what you are not expressing before. At least I
Mm,
can tell you maybe today now, maybe I've only gone to toilet to urinate once. But if by noon I find myself I've gone like 4 or 5 times and I'm drinking water always thirsty, something is wrong. It's not normal. Go
okay.
to the hospital.
Okay. So moving on to the clinical field, what are the available treatment options for diabetes? And is it a one-time thing, you just go and you're cured, or it's going to be a lifetime treatment?
Yeah, unfortunately, diabetes it's not like malaria because most that's one question many of my patients ask me that is this thing not going to end? Now looking at our type 1, they don't have insulin. Sadly, many of them, have to be on insulin for life because there's nothing they are not producing because of some things that happen in their body. The cells that produce insulin were destroyed, and those who have to be on insulin for life. Yes, which is sad. The type 2 own, whereas there are some drugs because they still have some level of insulin, but
Okay.
because there are other factors that are acting against that insulin working well. Commonly, insulin, we say resistance to it and some of that. So some drugs coming, you know. Yes, even people with type 2 also might need insulin in some cases. Yes, depending on how bad they come in with, they might need insulin. And insulin actually is the natural treatment because that is what is having a problem, isn't it? So
Yes.
insulin comes in for treatment. But apart from drugs, we also talk of lifestyle. Lifestyle is not just, yes, we still talk of prevention, but even in the management, most times when my patient come, is the lifestyle I emphasize more. I talk about drug last because we find that, let me just give more statistical information apart from the prevalence, how many people, which I
Mhm.
said, we found that majority of people with diabetes, especially the most common type 2, are in the urban areas, in the cities.
Okay.
Majority of them, yes, are in the cities compared to the rural areas. We find that our parents, the rural areas, they tend to be more physical. They walk around. Some of them trek long distances. Some of them eat natural foods, eat vegetables, eat things that they get from the farm. Unlike in the cities that the car is everywhere. We have people that they want to go from point A to B. They drive. You know, they are sitting, everything is at their fingertips. The computer is there, the phone is there to call, everything. Just a
Mhm.
touch, and they have it. And they are sedentary, they just sit in one place. And many of them, obesity is more in the urban areas, in the cities, because of these things. We don't do exercise, we sit down in one place, you know, we everything is at our beck and call. We eat processed food, fast food, we call them. Everything fast, 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 fast. We are in a hurry, you know. And
Mhm.
then we see people being overweight or on the large side, and that's one thing that has contributed to rapid development of diabetes. We will still go to prevention. So I tell them, look, I've seen some patients that say, just give me drugs and then make it just living my life. I say, look, is that living your life that brought you here the first case? you know you eat whatever you like, junk food, fast food, too much sugar, all these soft drinks. Many of them, it's not that they tend to directly predispose, to push people to develop these things that make you to gain weight, become so big, that resistance to insulin and other things come into play faster. And find that you, yes, the commonest form of diabetes, the common one, obesity is a problem. So when they come, we talk about things, lifestyle changes first. Then we now talk about the drugs. What are the lifestyle changes? Excess weight control. And how do we approach weight control? With exercise. People with diabetes advise at least minimum of 30 minutes of exercise in a day. And you say, oh, I don't have time. But when people develop, we will still talk about complications of diabetes. You suddenly find that you will have time by force. The person can't go to, is debilitated, is in the hospital. Yeah, so where does he want to go? So, but to prevent those things, to make it to continue to deteriorate, we advise exercise, even the diet. The kind of food to eat. People will tell them all manner of things, but we even, I talk to others. They also engage nutritional therapists, people that we guide people on kind of food to eat because people are told the wrong thing. Yes, carbohydrates still form the majority of the food, contrary to what people will tell them, because you need carbohydrate for energy to day living. You need protein, you still need some fat, you need balanced diet. But the problem with diabetes is that you can't be eating heavily in that because even with the drugs, your body can't handle large amount of food. Because most of us in Africa or in my home in Nigeria, some of us are not eating breakfast by now. Maybe it is around 11, 12. We call it brunch. Kenny, I hope you have eaten breakfast. So, we brunch, then it is dinner. And by the time you get home at night, you are very hungry. So we put a mountain of food and we clear it and go to sleep. We are eating heavily at the wrong time because you will not need it. You will sleep, and people will say, I only eat one major meal a day. Why am I still getting fat and fat, getting big and big? Yes, because you are eating it at the wrong time. When you eat heavily and sleep, what happens? Your body will convert those food to fat because you are not using it. You are not doing anything. Like my father used to tell them, why are you eating heavily at night? Do you want to go and fight war in the night? And we laughed. But he dawned on me that truly the man was right, that you don't need this kind of much. And why do we eat heavily? Because we skip a meal. Maybe we don't eat until around 10, 11, and there's no eating again. Maybe some people get home till around 8, 9, 10 in the night, very hungry. And you can't tell them not to eat heavy. So I tell my patients, you need to eat at least 3 moderate meals in a day. Breakfast, by lunch, so that by night you will not be feeling very hungry. So you just take something light. So when you are doing your exercise and you are eating moderately, hmm, and you can still eat balanced diet, you avoid refined food, you avoid soft drinks, what people call minerals, but soft drinks, sugary, direct sugar food, direct sugar snacks, all those direct sugar stuff. You leave those things, eat the more natural, eat vegetables, you still eat carbohydrates, but with high fiber content, and try and eat balanced diets. And then with the exercise, and you drink water adequately. And then we talk of drugs that the doctor will prescribe for you. We tell people to take their drugs adequately. Don't get discouraged. There are diabetes support groups. People who also have diabetes. Like in Nigeria, we have the Diabetic Association of Nigeria. Well, we encourage patients to be part of it. Majorly are found by patients. And they talk about the experience, they encourage one another. It's not easy to take drugs all the days of your life. Yes, some cases when we talk of prevention, maybe slowing down, and yes, some people get better, reduce the amount of drug because they kept to these lifestyle changes, exercise, weight reduction, proper diet. I think that's a nutshell, some form of um, management. I didn't talk too much about the drugs because what brought us here is our lifestyle majorly. Yes, there are some things you cannot prevent, like your family. What is known that if a parent or both parents have diabetes, the children are high risk of developing diabetes too, especially type 2 diabetes. You can't do anything about that. Nobody chooses the family they came to. We all came into our family. But the one you can do something about is my weight, is my sedentary lifestyle, sitting down, abandoning my body, eating all manner of junk food and all those things. I can do something about those ones. And if I work on my weight, reduce weight, do exercise, eat balanced diet, healthy food, vegetables, and some fruits, it can slow down the development of those things. I even try as much as possible to prevent. I even factor people will develop it. It might be much later in life, you know, because they kept to things that help them. Let me stop here for now. But let me briefly talk about the complications of diabetes.
Okay.
So, in complications, diabetes affects every organ, every part of the body. It's a common cause of blindness, whether by number one cause of cataract in the whole world. That people, those kind of people, they see them, you see as if that there's something white in their eyes, and they say they
Yes.
can't see. The lens of the eyes become white, and they can't see. Things like glaucoma, they can cause it, and some other kind of diabetic eye disease affecting the retina, the blood vessels of the eyes, and all those things. That's one complication that diabetes. Then diabetes is a big cause of kidney disease. Diabetes, along with hypertension, causes up to 80% of what we call long-term or chronic kidney disease in people. So it's a big problem. And that's why people who have diabetes, we are always watching for their kidneys so that they don't, know, to take care of people who have kidney failure is a lot of money. It cripples everything. It also affects the nerves. Is some of our patients, you see them complain, "Ah, my feet are burning, as if I have many needles pricking my legs. If I can't feel my feet safe. Sometimes I see blood is not flowing through the hands and feet. Those kind of things. You have some peppery pains. Those things are nerve disorders that can occur. They can have other things, digestive problem because of some nerves that supply the digestive system. Um, Diabetes is associated with stroke. You know, up to people who have diabetes have, stroke can happen to anybody. But when somebody has diabetes, it even increases it to over 50% to develop a stroke. Um, Other cardiovascular problems like heart attack
Okay.
increases to over 100% when diabetes comes into play. So diabetes is a problem. It's a big problem that needs to be. It's not something to be trivialized. I say, is it not just that thing? And then I swallow some things, it will go. No, we need to see doctors. We need to be monitored. People develop heart disease. When they develop diabetes, risk of death from heart and cardiovascular disease increases for over 100% when diabetes come into the picture. So we don't want such things, complications of diabetes like that, stroke, heart disease, the ones that the eye disease, the nervous disease, the kidney disease. And those are things, complications, even people become obese, overweight. They also get
Okay.
associated with some other cancers that, breast cancer, womb, cancer of the womb, and some other digestive tract cancers. So we really, really need to, people need to take their health very seriously. Even when they develop that, don't give up. Go to the doctor. There are many treatment options with lifestyle changes. We have many patients who are doing very well. I can say let me just say, I have a former president of my country, Nigeria, who is in his 80s. The other day he was talking to some young people with diabetes, type 1 diabetes. He encouraged them. He has had diabetes over 35 years or so. And he handled the what I call the most difficult job in the whole world to rule Nigeria. And he
It's
did it
actually
very
true.
well for 8 years, even with diabetes. So people can still be all they want to be. Even some of my type 1 diabetes patients, young children, very brilliant, doing very well in school, achieving a lot despite their diabetes. In the last, for me, World Cup or 2 years, there was a player in Spain who played in the World Cup, even with type 1 diabetes, I even scored a goal. No, he can achieve a lot by just managing our lifestyle, keeping our
Mm.
appointment in the hospital, taking your drugs. As it can be discouraged, but encourage yourself. People are achieving a lot despite the diabetes. It's not like a death sentence,
Yes.
as some people are made to live and once if somebody can live to over 80 years, 85
Mhm.
years with diabetes, become a president of a country, that's the number one job in any country.
That's
And he
true.
did it, and he's still alive after death. So people can still achieve, they can still fulfill, do a lot of things.
Yes, all right. Thank you for that answer, sir. Thank you for that. So, quickly rounding up, what would you say the take-home message for our audience is on diabetes? That's a brief
Yes,
summary of.
diabetes is not a one-time disease. It's a disease that sadly can span through a lifetime, and it is an underestimated disease, but it's a manageable disease. It can be managed because when and how do we manage diabetes? It's a lifestyle change because most of the people who have diabetes also came by improper lifestyle. Lifestyle in terms of diet, proper diet, good exercise, weight control to optimal weight reduction until you get to your optimal weight, and then taking your medication, whether it comes in form of injection by insulin or tablets, and seeing your doctors regularly. You people also we need to be checking their blood sugar. They have their small machines that they can use, we call glucometer, to be checking their sugar and be on top of their game, and seeing their doctors regularly. If they have issues, go to your doctor. It can be managed and you can still achieve all you want to be in life with good lifestyle changes and good management. Thank you.
Mm. Okay, thank you for that, sir.
Yes, you're
So to our
welcome, Kenny.
audience, yes, sir. So to our audience, thank you for sticking around. I hope you all have been able to gain some interesting insights on what diabetes is, what causes it, and how to prevent it, which is majorly lifestyle changes. So it's all in your hands. Thank you again, Dr. Olusegun, for obliging our invite, and have a
You're welcome.
wonderful day. To you, our
And
audience,
you
whenever
too.
you're watching this, you can share this with your loved ones to save them, or to your friends, your family members. This information is power, and you don't know whose life this information might be saving. Thank you, guys, and see you again next time.